Okay, good afternoon, everybody. This is probably none of you are in this vertical of radiology or medicine, but probably all of you would probably at some point in your life identify one of those problems that we're trying to solve. So I'm a radiologist. I'm founder of Total Medical Imaging, which is a teleradiology company, and RADIN Health, which is a technology company we're trying to help expedite all the radiology workflows. I train at Mount Sinai Hospital here in Miami Beach and did my fellowship and training in UM, in Jackson Memorial Hospital. I'm going to first go over a high-level overview of the complexity of radiology workflows and how we have implemented agentic AI automation to reduce costs, to improve efficiency, improve patient experience, and improve radiology quality and productivity. So in general, we can define the radiology journey in 3 stages, and most of you guys have an X-ray, an MRI, or mammogram. What happens before the scan is done, right? You get an order, you get a prescription, insurance, authorization. What happens at the scan, and then the radiology really begins. So a lot of the AI has been evolving in the past years, mainly in image analysis, and people say, okay, AI is going to replace radiology, it's going to read radiology. It's not going to happen, because to create a radiology report, you need a signature of a doctor. So the computer will never replace the doctor. So that's a myth. It's not going to happen. It's going to help us read the X-rays. But I'm not going to talk about that, because that is not going to help. That is not what is helping, or is going to help radiologists the most to be more efficient. That is going to help me more accurate. Maybe don't miss findings, or maybe detect something that are subtle, but it's not going to make it more efficient. The efficiencies are in the other 2 stages, 1 and 3, I'm sure you can. So this is an example just of image analysis. AI can show a fracture here that's very subtle, or maybe it can show a little nodule here. And a lot of money has been invested in this in the past 10 years, approximately 25 billion in corporate space, in Philips, Siemens. Startups up to $10 billion in the past 10 years. A lot of money going there. But as a radiologist, we identify where are the main inefficiencies. I can read an X-ray in 5 seconds and know where it is. I don't need a machine to tell me where it is. Where are the inefficiencies, right? And the efficiencies are in stages 1 and 3. Why? It's an order. You need to call the patient. You need to verify the insurance, estimate the co-payment, authorize, schedule, confirm, send instructions, fill forms, check in. The technologists know what to do. All that can be automated, and we did it. And on the other side, after the study is complete, needs to assign to radiologists. There are multiple who has more cases than the other one. To open the study, read the priors, the history, review images, dictate, finalize, corporate the findings. There's a lot of things happening before and after the scan, and a lot of inefficiencies that we can improve. So in both places, there are a lot of vendors, right? And each vendor is concentrating on one particular workflow. One can do the call, one can do the scheduling, the other can do the authorizations. And most of them are not connected to each other. It creates a lot of inefficiencies and put people to do that job, right? And a typical image is that there will be something like that. They have a vendor to receive the orders, another one to provide the telephone and receive faxes, connects to the banks, connects to the machine, connects to fax, and all the different workflows. And now the imaging center, maybe with an AI tool that helps identify a finding, but that's all is happening, and it's not connected to each other very well. It's very inefficient. So it looks something like this. And that's the owner of the imaging center, with all these bills coming from all the different vendors, right? And that's the employee, right? Paperwork, different computers, checklists, very, very inefficient, burnout, a lot of employees. That's the patient, right? That's you filling all these forms when you go to the imaging center, right? Fill this form, fill that form, I did it last time. Okay, you need to do it again. You need to sign, okay? Right? Okay, so we developed RADIN. So RADIN is a SaaS company, and we put all those workflows into a single application in the cloud, on a scalable, and we put AI on top of it. We put LLM, we put generative AI, we put agentic AI, and we automate the entire workflow. So just so you know, RIS is for radiology information system, PACS is picture and academic communication system, dictation for radiologists to create a report, and the workflow management is what orchestrates the workflow. Out of battery. Uh-oh. Next, please. It's not working anymore. Frozen? Okay. So, since your hospital or imaging center gets the order until you go to the scan, you need to go through all these steps. People doing these steps. And that's what it takes. 35 minutes here, 5 minutes here, up to 30 minutes for authorization. 85 minutes of human labor, which costs about $84 in an average of $30 an hour, just to get you on the table, on the scan. So how do we automate it? Okay. In our application, for example, the fax is receive an order, automatically the agent scans the order, identifies the patient, selects the patient, creates the order, enters all the information in the system. In the past, it used to be manual, right? A human was doing now, a bot is doing this. He sends the information in the system, he sends you the order, enter your phone number, the study you've been done, who's your ordering doctor, what's the reason for your exam, what other surgeries you have, all extracted by AI. Now the system is talking to the insurance company, getting your insurance benefits, okay, and saying how much you're going to pay for your co-payment and deductible. We don't control that, don't blame me. It's insurance system. It's filling all the information in the system for you, so then it's also calling the authorization, so imagine it gets paid for it, and then it's calling you, and you can talk to the bot, or you can text with the bot and make an appointment. And the bot will tell you, okay, this is your appointment, this is your information, so pre-filled for you, and this is what you have to pay. And then you go and you pay, and when you get to the imaging center, all the forms are done, the orders are done. You don't have to wait. You wait 1 minute and you go in. That's the idea. Automate the work. So now we were able to decrease the time from 85 minutes to 6 to 7 minutes. So the only thing, the authorization, sometimes the insurance don't want to authorize, you need to call them while you're authorizing to fight it back, right? And maybe 1 minute to check the patient in. That's about it, right? So we decrease the time 91%. So we save it now almost $40 in the cost. So that was the cost before, and that's the cost after. And now, like an MRI, for example, this analysis we did with one of our clients, the patient responsibility is an average of $180. The imaging center typically collects 75% of that, and it's a cost collection typically when patients don't pay. So the net tends to be 29, by automating the whole workflow. This is all paid up front. It costs $0. The upfront is 500% on the patient responsibility part. So we only decrease the staff, but we're also making 5 times more money. So now the scan is done, and now nobody knows it, but who's the right radiologist to read the study? If you had a brain scan, you don't want it to be read by a radiologist at a breast. If you have a breast scan, you don't want it to be read by a radiologist that reads foot. So who's the right radiologist, right? Is a radiologist credentialed to read for your insurance, right? Is a radiologist working right now? Is he tired? Did he read a lot of cases? Maybe you interview to somebody that didn't read a lot of cases. So in the past, all these studies, which are thousands, millions of studies done every day, staff used to allocate it to different radiologists, who's the right radiologist to read the study. Of course, we automate that. And now we have a bot. Now, getting all the information, the bot knows who you are, what part of study you can scan, what insurance you have, and it will be